to check services. This is something that the hygienists do at least a day ahead of time to go through appointments for the following day to make sure each patient has the correct services scheduled. So these are the hygiene columns for that day. You will first double click on a patient and you see these are the services scheduled for that patient that day: an exam, perio charting, and a cleaning, a prophy. So we X out of there because now we have to go to that patient's chart to make sure those are the correct services for that patient. So we take a look, and the patient was in February. They had a cleaning, a prophy, and they had their full set of x-rays and an exam. So we know they're not due for x-rays. So that is the correct services for that patient for this appointment. We change the provider, so we will make whatever the doctor is for that column, whoever the hygienist is for that column, we put the correct providers in there. Because this patient is not due for x-rays, we will keep them under appointment type prophy. If they were due for x-rays, we would put it under prophy with exam. Even though they'll still be getting an exam, it just denotes whether or not they need x-rays. One other type of x-ray a patient might need when they're not due for their checkup x-rays, like this patient, for example, we go back to their chart and take a look at the default view. That just shows us anything that the patient has had done to their mouth. So if this patient had some pending restorative treatment, sealants don't count, but pending restorative treatment, past crown, implant, or root canal, whether it was done by us or someone else, we want to take a PA of that area so we have a record-keeping x-ray of it. If they have watches, which would be noted with little W's along this, the root line, then we'd want to take an x-ray so we could just double check see if the decay has spread. So that would be one thing if this patient had any of that, which they don't, but if they did, we would want to add a PA or multiple, depending on how many crowns or root canals or whatever we needed to take an x-ray of. So we would add that here, but they don't. So that appointment is done there. So then you go down to the next appointment. I'm not going to use this patient because there's a little bit of confusion on their chart. So let's go down to this next appointment here. This patient is scheduled for a prophy, x-rays, and an exam. Let's double check that those are the correct services for that patient. Completed. Okay. The patient was in January and had perio charting, prophy, and an exam. So that's perfect. Patient is due for x-rays. But this doesn't look quite right. So we will change the provider to whomever the doctor is or the hygienist for that column. And then we want to change the appointment type to prophy with exam. And you'll see it will change the color as well. So click OK. And now that is the correct color for that appointment. Then we just keep going down until the whole column has been checked. Once the whole column has been checked, I like to go to a previous day. This column has also been checked, so I like to right click, copy block, and then right click again, paste block. If this is not the correct date, you right click again and edit block, and then you put the correct date for what day that column was checked. And that is how we check our services and familiarize ourselves with what each patient needs.